My name is Dr. Ani Babikian. I am a second-year spine care resident at Southern California University of Health Sciences. I am certified through the McKenzie Institute for lumbar spine diagnoses and corrective exercises. With me today is sport medicine resident, second year, Dr. Nathan Sermeno, also from Southern California University of Health Sciences. He will be simulating a patient. This is an introduction video to end range loading and corrective exercises. During the initial exam, you will be performing a detailed history of the patient's chief complaint. After ruling out red flags, evaluating the Keel questionnaire, and subcategorizing the patient into low, medium, and high risk for poor clinical outcome, you will begin end range loading. This can be repeated 5 to 10 times in every degree of motion. What you're looking for is centralization, peripheralization, or no change in the patient's symptomology. Let's begin with end range loading. We'll go through all the different ranges of motion and repeat them to 5 times. First, we will start with flexion. With flexion, generally and most commonly you will see that the patient's symptoms do peripheralize. Then we will go into extension, hands in the small of the back and extending back. This motion is generally seen with centralization of symptomology. Next, we will do side gliding. This is performed with the hips side gliding to either side. You name the side glide to the direction of the shoulders. So in this instance, he is performing left side gliding. We will also do right side gliding. And lastly, rotation. Generally, I like to have the patients come into a bit of flexion, cross the arms, and rotate to both sides. First, we will do right rotation, followed by left rotation. After observing which motions centralize the symptoms of the patient, we use these simple exercises to be given to the patient so they can be done at home. The aim for this is to be self-directed, self-treatment exercises for correction of symptoms. First, we'll start with side gliding. This will be done against the wall, with the patient's shoulder against the wall, crossing the arm across the chest, and using the hands to direct the hips against the wall and pushing back out. Next, we will show you flexion. Flexion as well as extension will be done on a flat bed. Flexion is usually single and double knee to chest. You'll start with one knee to the chest, switching to the opposite side, and bringing both knees to the chest. And lastly, extension, which is the most commonly used. You'll have the patient lie on their stomach, back and stomach is relaxed, having the elbows underneath the shoulders and pushing up and then coming back down. This is a repeated motion. Again, this is a brief introduction to end range loading and corrective exercises.